Our last speaker of the morning, Ms. Laura Carabello. Laura is not a chiropractor. She is an entrepreneur and strategic marketing consultant, and she is an extraordinary consultant in that regard. Laura, in her career, has worked with over 1,000 corporations and companies working on their behalf relative to their public relations and their marketing strategies. She completed her Bachelor of Science in Journalism at the Newhouse School of Communications at Syracuse University. She has a very deep and extensive knowledge regarding international healthcare and national healthcare, and has been involved for more than 25 years in business-to-business and direct-to-consumer activities regarding healthcare technology companies, and the critical role of bringing these elements into the 21st century. Laura has been called upon to lead industry consortia and consults to numerous professional and healthcare organizations, including the Cooperative Exchange, the Regulatory Harmonization Institute, the COPD Foundation, and fortunate for us, the Foundation for Chiropractic Progress. On a personal note, I have had the chance to serve as a member of the Executive Committee and the Board of Directors of the Foundation for Chiropractic Progress, and to also serve as a spokesperson for the Foundation. And it has caused me to work very closely with Laura, her husband Joe, and her staff at their offices in New Jersey. And I cannot tell you the countless hours, the endless numbers of phone calls that they have invested, the travels they have made all over the country at a moment's notice to represent our profession, the Foundation, and the interest that we have to bring positive press to the chiropractic profession. And she has done all of this, 100% of it, as a volunteer on an unpaid basis on behalf of the Foundation for Chiropractic Progress, discussing the question of value-based design in healthcare as it relates to chiropractic and the Affordable Care Act. From Elmwood Park, New Jersey, Ms. Laura Carabello. Laura?
And it is my pleasure to be here, and I thank Dr. Klum for inviting me today. And I have a bit of a cold and a little bronchitis, so if I cough, you'll have to excuse me. When Dr. Klum asked me to do this presentation, he didn't tell me it was right before lunch, so I know you're anxious to get out, so I'll make this as concise and brief as possible. And my slides were produced, actually developed over the last I would say 6 or 8 weeks. But four interesting things happened to me that I thought you might find interesting over the last week. First of all, I was at a conference down the street here in Atlanta, the Institute for Healthcare Consumerism this week, actually yesterday, where the Foundation had a major presence, the Foundation for Chiropractic Progress. And by the way, I'm a great friend to the Foundation, and the Foundation is a great friend to me. Where we presented on behalf of the profession, and Dr. Bruce Sherman, who is he calls himself a recovering pulmonologist, very, very nice guy from Ohio, presented on our behalf on value-based benefit design and chiropractic. He is actually one of the authors of the paper that we had developed about 2 years ago on value-based design when it was first coming into vogue. And Dr. Sherman is on the Center for Health Value Innovation. I can't tell you, even he was amazed at the response of the employers in the marketplace when he presented the data on chiropractic. So much so that after the meeting, he said to me, Laura, we've got to do this more often. We've got to get this word out. Nobody knows about chiropractic and the value that it brings to the employer. So I said, you just name the date and we're going to be there. And so we are going to be presenting in Ohio. He also consults, he's also the medical director for a major corporation that I cannot mention the name of now, but invited us also to partner with this corporation on demonstrating the value of chiropractic. So I thought that was a very good sign for us. Another thing I learned last week, I was at another Institute for Health and Productivity and Wellness. There was no mention of chiropractic there. It was strictly employers, and they were international employers. And they were talking about all the different problems that employers were having and the programs for wellness and smoking cessation and all their outcomes. And it was data for 3 days. It was actually a trial to be there on the 4th day. But one of the pieces of data that I thought you might find very interesting is that back pain is the second leading cause of depression. And you know what depression is costing the United States and employers internationally. And so if you look at the costs of the pharmacoeconomics of depression, if we can even make a dent in that, relieving that, we would be having a major impact on depression. And I didn't realize that depression was such a, had already generated so much attention from the employers, and that back pain was actually the second leading cause internationally. I also learned this week, because I've been very involved in the medical home model and the inclusion of chiropractic in the medical home model, that NCQA is not the only game in town. We have learned that URAC is now accrediting medical homes, and there is a good chance that we can get chiropractic before URAC, which is the standards organization, not-for-profit standards organization in managed care, that we can get chiropractic recognized, and somebody mentioned it before, as being the primary care leader. The collaborative leader seems to be what NCQA wants us to be, but there is a good chance now that chiropractic will get before URAC. So I thought you'd like to hear that. And the final thing is, last week we had a conference call with the head of the Virginia Business Coalition on Health. Not only is she an advocate of chiropractic, and she's going to be a champion for chiropractic, you're going to see her ad. She agreed to have her picture as a champion for chiropractic in USA Today and the Wall Street Journal. But she really gave us some insight into these medical homes and what the employers look at the medical home. They are very, very opposed to those medical homes that are owned by hospitals. You know, these hospitals are acquiring physician practices and setting up these medical homes. She said the employers don't like it. It's 400% more expensive. So they are looking to the non-hospital-owned medical home model. That's our chance, and that is our big opportunity, because there's plenty of them around. So I just thought I would share those 4 little pearls of wisdom that I've learned over the last week, and I thought you would appreciate that. And now I'll try to get through my presentation as quickly as possible, because I know you're all hungry and anxious to get on with it. Is this the button that I use to advance? Okay. I know you heard from the absolute guru of value-based benefit design, which is Dr. D. Eddington, and he is recognized nationally, internationally. So what I'm going to tell you now may be somewhat repetitive of what he said, but I'm going to try to bring it into the chiropractic community, because I believe that value-based benefit design and value-based insurance design will look to chiropractic to be part of that scenario, and that's what most employers are adopting, is value-based benefit design, and we fit in. Not only do we fit in, we are the epitome of what value-based design should look like. What is our challenge to getting into that scenario? We don't have the data yet. We don't have evidence-based data yet. But don't worry, we are going to get it, because the foundation is working on 2 separate projects now. We hope to be announcing them very soon, where we will be able to document the value of chiropractic in a value-based scenario. And we're going to get into that right now. Oh, that's me. You don't want to hear any more about me. Value-based insurance design. And let me say that value-based insurance design, you're going to hear terms like value-based benefit design, value-based healthcare purchasing. It's all the same. It all means the same thing. It all translates into the same thing. And here we are as a strategy that eliminates out-of-pocket cost for high-value services. And I would consider chiropractic as a high-value service. So what we have to do is to incent people to go to the chiropractor first, not wait till they are referred by either a primary care physician or somebody else. But how do we incent them? And on a value-based, if we can make the case for chiropractic to be the first line of defense, that's where we fit into value-based design. That's how we not only generate better outcomes, but that's how we save these employers and these payers a ton of money. We remove the barriers, so we remove copays, we minimize the expense for the patient. And that's what they're doing right now for other forms of treatment. So if you hear that they are eliminating the out-of-pocket expense for a mammography, you know that they want people to get mammography. They want them to get an A1C3 screening for diabetes. They want them to do these things, so they eliminate the copay or they eliminate the cost altogether. Now, Can you imagine that for chiropractic? And that's what we're going to be demonstrating. We're going to be providing the evidence through a large employer or multiple employers that chiropractic, we should eliminate these huge copays that patients are forced to pay and go to the chiropractor first. The pillars of VBID, and I say VBID because I think that's what Dr. Eddington likes to use as the scenario for the acronym for value-based design, is greater incentives, establish disincentives to low-value services. So if there are services that are not of much value to the outcome of the healthcare of the patient, we shouldn't be supporting them with any kind of incentives. And the premise is to align the patient's out-of-pocket costs, such as copays and premiums. So that's what we're hoping to establish. Now, other specialties, other doctors, other tests, other laboratory, other procedures have already established it. We're not late in the game. Thank goodness we're on time with the game, because I think as we get these demonstration projects going in different employer settings, and we're working with some very, very high-end people to establish this credibility. One of the things Dr. Sherman said yesterday, and I have to share this with you, he said, I've learned a lot about chiropractic, is what he said, in the last year, because I've now understand the value of chiropractic, he said, but they just don't have the credibility, they don't have the research, they don't have the reports in the high-end journals. We're going to change that. The Foundation for Chiropractic is going to change that, because we are going to get published in some very high-end journals that people will take notice of. Dr. Nitish Chaudhry, who is the professor of epidemiology at Harvard, he is a hospitalist, he is an MD, he is our biggest champion. I wish he was here today to share this with you, because he's such a fabulous guy, and he believes in chiropractic now. And so when he speaks on our behalf and talks about chiropractic and will be part of this value-based demonstration project, people listen. People listen to people like Dr. Sherman, who advises major corporations like Whirlpool and Walmart. They listen. So I think we're on the right track, but we have a lot of work to do. So that's why we need you all to be a part of this great adventure that we're going on. So what do we want to do? We want to lower the barriers for your services that the employees have to get. We want to reduce copays, and we want to place higher barriers for low-value services. Some of the evidence-based colon cancer, tests for diabetes, glucose testing, I mentioned those. I want to add chiropractic to that. I want there to not be barriers. I don't want people to be punished for going to the chiropractor. Sometimes I feel like the health plans, we're going to punish you. We're going to make you pay a lot of money because you want to see a chiropractor. We want to eliminate that. We want to eliminate all of that. And it's a question of persistence. The bottom line is to achieve improved health outcomes at any level of healthcare expenditure. Significant increases in patient compliance and potential cost savings result. And that's what our message is. Testimonials to value-based Aetna, eliminate copayments. Ron Williams, chairman and CEO, they're adopting. All of the major payers are adopting value-based design. Towers-Watson survey, by 2014, 49% of employers will use value-based benefit design. This is the way of the future, and this all ties together with the medical home, the accountable care organizations. This all ties into value-based benefit design. We know that spinal disorders, and I don't mean to go back to it as a total, solution for chiropractic, but we know we have the edge here. We know we have it. We should leverage this to the hilt. It doesn't have to be our end-all, be-all of treating a patient, but it's certainly a great place for us to start, and to start this conversation, because we have the evidence-based data behind it. We know what it's costing, we know the economic burdens to employers, and we can validate that. The total employer cost of back and neck pain, you can see we're up there. That is one of their highest costs. So if we can get in at that level and convince them of that at that level, we can certainly get to the next level, which is we do want to be the total wellness professional, and we want to take care of patients for total wellness. But why not go in with our strongest card? It's like a lost leader. We are it, and we've got to make the market understand that. when I say we, the foundation commissioned this paper, and Dr. Bruce Sherman was one of the authors. If you haven't read this paper yet, I urge you to do so. Those of you who can get it online, you can download it from the foundation website. I think we even have copies of it here. I urge you to do so because value-based benefit design is where we're going to be. I don't say you have to memorize it. Just get familiar with it because you're going to see a lot more of it from the foundation. We know that physical health is affected by back and neck pain. I'm going to run through some. We see that, this is Dr. Chowdhury, by the way. Dr. Chowdhury is the one from Harvard that has been speaking on our behalf and is actually pioneering this whole value-based benefit design for chiropractic with us. So we've got people from Harvard, people from Stanford. I mean, we can't get any better than that. And if we have the people from Life, that completes the triangle. This paper was commissioned about 2.5 years ago. Actually, Dr. Klum and I went to meet with Dr. Milstein. Dr. Milstein is like the guru of healthcare. And if you read the Wall Street Journal, you're going to see Dr. Milstein quoted on any kind of innovation. And my first meeting with him, he said to us, you know, my mother swears by her chiropractor. He said, that's one of the reasons I'm taking this on. To get his attention and to get him speaking for us was a major, major victory for chiropractic. And he's still in our camp. He's still in our quarter. He brought Dr. Chowdhury on. Dr. Chowdhury brought on Dr. Sherman. Now we have this assemblage of some of the best minds in medicine, in traditional medicine, speaking on behalf of chiropractic. So isn't it worthwhile to collaborate with them? The time for collaboration, I think, especially in academia, is here. This is the paper that is quoted everywhere. And if you haven't read this paper, you should really read this one as well. These papers are not like, light reading. This is not something to read like late at night when you're tired. Put your concentration into it because this demonstrates the value of chiropractic. And I'm going to talk faster. The key findings of these papers is that chiropractic intervention is an area where new analysis may define the placement in the care continuum. It is important for patient-centered care and low numbers of PCPs. And chiropractic supports early engagement between the patient and the clinician with shared accountability for outcomes. Now, let's not kid ourselves. Shared accountability also results in shared income. So if you can get to be a part of this patient-centered medical home, there's a good chance that you will be rewarded financially for this as well. I'm going to run through some of these slides because I think if you want to get this slide presentation and really look at how we're documenting chiropractic now, we're documenting it in a whole new way. We're not just saying we're better. We're not just declaring we're better. We're not just in the marketplace saying, come to me because I can make your back feel better. We are documenting now in evidence-based terms, evidence-based healthcare, evidence-based value-benefit design, what the value of chiropractic is. Show me the money. Show me the numbers. Here are our numbers. And this was one of the most intensive slides that was included in the Mercer report on how we improve the quality of life for patients and how they measured it and how Dr. Milstein measured it. By the way, Dr. Milstein is a professor at Stanford now. He was head of Mercer Consulting, which is a large employee benefits concern out in California. He's also the medical director of the Pacific Business Group on Health, which is the one of the largest employer coalitions for purchasing health care. Here's some more analysis. Look at our cost savings. You know, in today's market, cost savings are everything. I mean, quality of life is great, and everybody gives it lip service. You want the patient to feel better. But, you know, in this new market, cost savings are it. And we can save the system a ton of money. For neck and low back pain, chiropractic care represents a relatively greater value treatment approach based on treatment costs and clinical outcomes, and it's established for consideration and incorporation of a value-benefit design. And that's how we're going forward. That's the premise that we're using, and we're getting everybody to believe it. Value-based insurance benefit design and the patient-centered medical home, steering employees to better, higher health care value, and removing barriers for services, which we discussed, and the PCMH, and I think we have a really good shot at with this PCMH. I encourage all of you to look at your local community, see where the PCMH exists in your community and get involved, because the toolkit that the foundation has put together will give you all the materials that you need to get involved in that patient-centered medical home. Those of you who have been on our webinars, we've given you instructions. We have more coming. And if you need anything, if you need any personal guidance on getting involved in the patient-centered medical home in your community, give us a call. Tell Dr. Klum. And we have another webinar coming up. I think the more you learn about it, the more you'll see how you fit in. The Foundation for Chiropractic Progress, we also did, as you heard before, the patient-centered medical home white paper. We like writing white papers because one of our goals, our key mission in the foundation is to drive positive press for chiropractic. And we find that these white papers drive a lot of positive press in the trade, employee benefits, and the trade and industry journals. The synergies between VBID and PCMH are to improve quality and continuity of care in a fiscally responsible manner. Dr. Mark Fendrick is another one of those gurus. He stands right beside, excuse me, Dr. Eddington. Someday you should probably invite him to be here as well. Here's Mark is introducing these incentive programs, value-based benefit design. University of Pittsburgh Medical Center, their health plan. This just came out, by the way. Their new guidelines, their 2012 guidelines, require patients to complete a 3-month trial of chiropractic, physical therapy, and back exercise and counseling before they see the orthopedist. That's what we want to drive. We want patients to come to us first. And by the way, if they come to us for back pain, doesn't mean that we can't get them to be one of our patients for other services as well. It's almost like our lost leader. Do you all belong to the foundation? Does anybody belong to the foundation? Well, everybody in this room should be belonging to the foundation. I am a volunteer, so I am giving all of my experience and the value of what I do in the marketplace, which is dealing with healthcare and employee benefits and the whole spectrum of how healthcare is delivered in this country. I am actually literally giving it and our services to the chiropractic profession. I ask you, I don't beg you, I just ask you to step up and be counted with the foundation to make sure that you belong at whatever level. And we have some exciting programs coming underway that I think you will not only find interesting, they will be to your value as a professional. And you're going to see us in the newspapers and maybe even on the Super Bowl. So we need your help. There's no doubt that we need your help. So I encourage you all to get involved, to at least join the foundation at whatever level is good for you. I know we have student rates as well. I encourage every chiropractor to be a part of us and a part of our initiatives. Do you have any questions? Yes. Joe, do you remember we were at this meeting last week? I can't even remember what the first cause was. It might have been cancer, the diagnosis of cancer. I think was the leading, but low back pain was number 2. And it was really high up there. And all the other comorbidities were way, way down. It was like low back pain and cancer were number 1 and number 2, but they were really close, and then everything else was way, way down.